Medical professionals are calling on the UK government to restore social distancing restrictions as COVID-related hospitalizations and deaths rise to levels not seen in months. England eased most restrictions back in July. The UK had one of the fastest vaccination rollouts in the world. Now the government says it's relying on booster shots to protect the most vulnerable.
This is how the UK wants to get through the winter. A third COVID-19 shot for 30 million vulnerable people. But many vaccination centres have closed and the vaccination programme is sluggish. 76-year-old Ivor Garfinkel died while waiting for his booster shot. His son blames the slow pace.
He was literally going out shopping, going into his hospital checkups and things like that. And he caught COVID. And 11 days later, he died. I genuinely do think a booster might have saved his life.
Case numbers are the highest in Europe, but a vaccination rate above 67% has kept down severe infections and deaths. After lifting all restrictions in England, the government's strategy seemed to be working. But the tide is turning. The UK registered 223 deaths on Tuesday. Nearly 1,000 people were hospitalised.
We have relatively low social distancing measures compared to much of Europe. The other big thing is, I think, immunisations. That immunity from either previous infections or immunisations are almost certainly beginning to wane.
The protection offered by the AstraZeneca vaccine, the most widely used in the UK, appears to decline significantly over time. But boosters are urgently needed for other vaccines too. The UK's National Health Service says it's time to act. They're calling for the government to trigger its Plan B, a set of measures including mandatory mask wearing, vaccination passes in certain settings, and recommending people work from home.
It's a very simple choice. Do we accept the overwhelming evidence from all parts of the health service and do what we can now to reduce the risks in a way that doesn't disrupt our day-to-day life? Or do we somehow cross our fingers and hope that a miracle will happen and then stumble, as we have done before, stumble into crisis?
Is it time for a COVID Plan B, Prime Minister?
The government is rejecting calls to trigger fresh restrictions. At a news conference on Wednesday, the Health Minister said he expects up to 100,000 cases a day in the coming weeks, which means more severe infections and deaths are likely inevitable. He appealed to the public for voluntary support.
If we want to secure these freedoms for the long term, then the best thing that we can do is come forward once again when that moment comes. There are many more things that we can all do to help contain the spread of this virus, like meeting outdoors where it's possible, and if you can only meet indoors, letting in fresh air, like wearing a face covering in crowded and enclosed spaces.
When asked why ministers in a packed parliament weren't wearing masks, the health minister conceded good point and said lawmakers should set an example. Winter is coming and healthcare workers are already feeling the pressure. Yet another concerning new variant is making its rounds, and the coming weeks may well be decisive for the United Kingdom.
Well, let's go to London now, where our correspondent Charlotte Chelson-Pill is standing by. Charlotte, why is the UK struggling with COVID more than many of its European neighbours now, despite having a hugely successful vaccination rollout?
Well, you're right. The UK vaccination rollout was very successful. It undoubtedly saved many lives and prevented many more from developing a serious disease. But as you just heard there in the report, the case numbers are rising and there is a good deal of concern. Yesterday, for example, case numbers almost reached 50,000 here in the UK. That would, of course, be a very significant landmark. Now, as for why this is happening, there are no simple answers to this, as many experts have been saying, but there are a number of theories, a number of contributing factors. They point, for example, to the fact that because the UK was so quick on the offset when they started rolling out the vaccine programme here in December last year, it's possible those vaccines' efficacy could now be waning. You mentioned in that report as well the fact that the UK has relied heavily on the Oxford AstraZeneca vaccine. That's believed to be less effective against the Delta variant, which is dominant here in the UK. You've then got the vaccine rollouts slowing down. There have been slower than other countries on vaccinating teenagers. The booster program as well, some criticism there that has been too slow. Combine all of that with the fact that since July, there have been no real restrictions here to speak of. You mentioned even in Parliament, people on the front benches not wearing masks, not setting that example. All of that is contributing to this picture and this concern felt by so many about these rising case numbers as we go into winter.
Rising case numbers, rising hospitalizations, rising death rates, the medical community urging the government to take action. Why, Charlotte, does the government not feel compelled to implement more social distancing measures?
Well, the government did hold its first press conference in a number of weeks yesterday, saying that it was looking at these case numbers very closely. It was following the data, but it said that it did not feel that at this stage, the pressure that was on the health service in the UK was unsustainable. And it said that it was waiting, therefore, to impose what it calls Plan B, measures like seeing compulsory face mask wearing in public spaces. Now, the UK has had 3 very tough lockdowns. They've damaged the economy. The government reluctant to impose any further measures. They're stressing instead the need for personal responsibility, for people to take it upon themselves to get the vaccine, get the booster jab. And that was really what was emphasized in that press conference yesterday. But as we've said, so many in the medical profession are coming out now saying that that is simply not good enough at this stage. I think we have a quote from the British Medical Association. It represents doctors. They've said the government is being willfully negligent not to be taking any further action to reduce the spread of infection. This is the time to learn the lessons of the past and act fast, or else we will face far more extreme measures later. And that really is the message that we've heard from a number of people. There's been criticism that the government has been too slow to act in the past. They say that lessons now need to be learned and action needs to come faster.
Charlotte, thank you very much. Our correspondent Charlotte Chelson-Pill there in London.